Your body has an incredible ability to signal when something is amiss. However, these early warning signs can be subtle, so subtle that many people overlook them, attributing them to aging or stress. It concerns me, especially when speaking with individuals over 50, how many are unaware of their diminishing kidney function. They may struggle with fatigue, swelling, or changes in urination, adapting rather than questioning these issues. They often assume it's simply part of getting older. Yet, kidneys don't just fade away quietly. They communicate, beginning with symptoms that must be acknowledged. As a physician, I can affirm that kidneys are among the most undervalued yet crucial organs. Daily, they filter about 50 gallons of blood. They eliminate waste, manage blood pressure, balance electrolytes, aid in red blood cell production, and uphold your body's chemistry. Here's the unsettling reality. Once kidney function starts to decline, it doesn't rectify itself. It deteriorates progressively, sometimes slowly and stealthily. By the time more evident signs emerge, irreversible damage may have occurred already. One of the first signs I frequently observe, and often the most neglected, is ongoing fatigue. This isn't just the type of tiredness that eases with rest. It's a profound exhaustion that makes even simple tasks feel overwhelming. You could rest for 8 hours and still feel drained throughout the day. For some individuals, this becomes their new normal, but it shouldn't be. The medical explanation is significant. When kidneys fail, waste products and toxins accumulate in the bloodstream, interfering with every bodily system, especially how red blood cells operate. Healthy kidneys produce erythropoietin, a hormone that prompts your bone marrow to generate red blood cells. A decline in kidney function results in reduced erythropoietin production, leading to anemia. Without sufficient red blood cells to deliver oxygen, fatigue ensues, both mentally and physically. This oxygen deficiency impacts your muscles, brain, focus, and overall energy. It's not merely fatigue, it's your body suffocating from within, gradually and silently. Swelling, typically found in the feet and ankles, frequently accompanies kidney decline. While some patients attribute it to prolonged standing, there's a notable difference between temporary swelling and chronic edema. With kidney failure, fluid retention occurs as the organs can no longer efficiently eliminate excess sodium and water. This fluid tends to seep into tissues, especially in gravity-dependent areas like the lower legs. You might notice deep impressions from your socks on your skin. Shoes that fit well in the morning may become tight by afternoon. In some cases, swelling can escalate to the calves or even the hands and face. If swelling persists overnight or worsens, it's a significant red flag. Another concerning indicator in clinical practice is any lasting change in urination. This may manifest as more frequent nighttime urination, sudden urgency during the day, or unusual urine appearance. One of the most alarming changes is foamy or bubbly urine, often described by patients as resembling soap suds. This can indicate protein, particularly albumin, leaking into your urine, a condition called proteinuria. It occurs when the kidney's filtering units, the glomeruli, sustain damage. Protein should remain in your bloodstream, not be discharged through urine. Moreover, changes in urine color, especially dark, brown, cola-colored, or pink, can signal blood's presence. Some patients may also experience a persistent urge to urinate at night, known as nocturia. This isn't solely related to hydration habits or age-related bladder issues. When kidneys cannot concentrate urine efficiently, the signal to eliminate fluid becomes more frequent and less effective. These are not random quirks. They are your body's way of indicating a serious issue that warrants attention. Shortness of breath is another symptom often overlooked concerning kidney function. When patients mention becoming winded while ascending stairs or feeling breathless during simple activities, we initially rule out cardiovascular or pulmonary issues. However, many are unaware that kidney failure hampers oxygen delivery in two primary ways. First, through anemia, which reduces oxygen's reach to your tissues. Second, excess fluid can end up in your lungs, known as pulmonary edema. This condition feels like breathing through water. Initially, it may cause mild shortness of breath, but if left unchecked, it could become life-threatening. Persistent nausea and unexplained vomiting are distressing symptoms that patients frequently experience. When waste accumulates in the bloodstream, the digestive system suffers. Toxins disrupt both stomach lining and brain appetite regulation centers. Meals you once looked forward to become unappetizing. Eating feels burdensome. Nausea may arise unexpectedly, often resulting in vomiting or loss of interest in food. This state, uremia, is dangerous. It indicates that your blood is cluttered with waste that your kidneys can no longer filter. Many patients unintentionally lose weight, not from dieting but from their bodies slowly poisoning themselves. Another often underestimated sign is persistent itching. This is not simply dry skin, it's an intense itch that no lotion can relieve. This sensation stems from a blood issue. When kidneys fail to filter adequately, phosphorus and other waste products build up. These irritants affect nerve endings in the skin, causing a deep, maddening itch that intensifies at night. Some patients scratch until they bleed, finding no comfort. Traditional anti-itch treatments are often ineffective, since the root problem lies beneath the skin's surface, in your blood chemistry. Each of these symptoms can be easily overlooked, misattributed to aging, lifestyle choices, stress, or poor sleep. However, collectively, they create a pattern that medical professionals are trained to recognize, which could potentially save your life if identified early. When kidneys start deteriorating, the impacts extend beyond fatigue and swelling. The internal equilibrium of your body shifts, from hormonal and electrolyte balance to blood pressure and brain function. I often tell my patients, when kidneys struggle, your body doesn't just feel tired. It feels unwell, in complex ways that are challenging to explain, but impossible to ignore once recognized. A common complaint I hear from individuals with declining kidney function is a peculiar taste in the mouth. Patients describe it as metallic, bitter, or unpleasant. Food loses its flavor. Beverages, even water, can taste strange. This metallic taste is indicative of the underlying issues in your bloodstream. As kidneys fail to eliminate waste, toxins circulate, influencing your saliva and altering taste perception. This can lead to difficulties in eating and, eventually, contribute to weight loss and nutrient deficiencies. Muscle cramps are another frequently disregarded warning sign. Not just an occasional Charlie horse, these cramps are extreme and can strike suddenly, often disrupting sleep. They indicate a critical electrolyte imbalance. Kidneys are vital in managing potassium, calcium, magnesium, and sodium levels. When kidney function deteriorates, this balance falters. High potassium or low calcium levels can lead to involuntary muscle contractions, some of which can be life-threatening. These imbalances may also disturb heart rhythm, which is why I take muscle cramping reports seriously, particularly in older individuals or those with chronic conditions. Let's also discuss brain fog, often dismissed as just getting older. You might enter a room and forget why. You could reread the same paragraph multiple times or struggle to find simple words. While age affects memory, persistent mental cloudiness warrants attention. Kidney dysfunction notably influences cognitive function. When toxins build up in your bloodstream, they don't remain confined to your organs. They affect your brain. Uremic toxins can cross the blood-brain barrier, disrupting neurotransmission and memory processing. Patients in early kidney disease stages often report diminished mental clarity and focus. If untreated, this could lead to uremic encephalopathy, a severe brain dysfunction linked to advanced kidney failure. The positive aspect is that cognitive symptoms commonly improve once the primary issue is resolved. However, timely recognition is essential. Another subtle but evident signal is puffiness around the eyes. You may notice your eyes look swollen in the morning, or that your eyelids are puffy, even after adequate rest. This is particularly common in early-stage protein loss due to kidney dysfunction. Healthy kidneys retain proteins like albumin in the bloodstream. When filters are compromised, protein leaks into urine. Consequently, osmotic pressure in the blood drops, causing fluid to accumulate in soft tissues, particularly around the eyes. This swelling is often most noticeable after lying flat, making it prevalent in the morning. It's not merely cosmetic, it suggests your kidneys may be leaking essential proteins. Next, let's discuss high blood pressure. Many view it as a separate issue, managing it with medications. However, high blood pressure and kidney health are intricately linked. Kidneys regulate blood pressure via fluid control, sodium balance, and hormone production. When they falter, this regulation derails. Fluid accumulates, raising pressure against arterial walls. Concurrently, kidneys may produce excess renin, a hormone that constricts blood vessels. This creates a dangerous cycle. High blood pressure further damages kidneys, and impaired kidneys elevate blood pressure. Hypertension is both a cause and a consequence of kidney disease, which is why anyone with resistant high blood pressure should undergo kidney function evaluations, especially if other symptoms are present. Another commonly overlooked symptom is persistent dry or flaky skin. For many, this appears to be a minor irritation. Yet, in the context of declining kidney function, it serves as a telling clue. Your skin reflects what occurs beneath the surface. Healthy kidneys help maintain balanced mineral, hydration, and nutrient levels, keeping skin supple. When these organs fail, phosphorus and calcium imbalances affect skin turnover. Dryness, cracking, and flaking may ensue, often accompanied by discomfort. In advanced cases, this becomes severe, leading to itching and skin breakdown. No cream can correct this issue. It's systemic. As kidney function declines, shifts in appetite are nearly certain. Patients frequently express, "I just don't feel hungry," or "food doesn't interest me." This isn't willpower deficiency or a mere side effect. It's your body reacting to biochemical signals instructing it to avoid food. Uremic toxins disrupt hunger-regulating hormones, while low-grade inflammation signals the brain to suppress appetite. This spiral culminates in decreased food intake, leading to muscle loss and nutrient deficiencies, accelerating kidney decline. Often, visible weight loss occurs after the underlying damage has begun. What connects these symptoms is not their intensity, but their collective pattern. Fatigue, swelling, shortness of breath, changes in urination, muscle cramps. Any of these might appear manageable or unrelated when viewed individually. However, when they emerge together or gradually worsen over time, it's crucial to step back and consider the bigger picture. One of the greatest tragedies I encounter in medicine is patients seeking help too late. When kidney function drops below 20%, options shrink, and dialysis or transplant is the sole solution. However, it need not escalate to that stage. The earlier we recognize warning signs, the more options we have to intervene. Lifestyle alterations, medications, dietary changes, and vigilant monitoring can all help preserve kidney function for years, if not decades. What troubles me most about kidney disease is how quietly it can manifest in its early stages. These organs are resilient. They can operate at a reduced capacity for an extended period before clearer symptoms arise. Often, individuals don't connect the dots until several systems in their body start to falter. At that point, we aren't discussing prevention. We are focused on mitigating damage that has already advanced. Among the more understated signs of kidney failure is a growing feeling of being off. Not quite ill, but not quite well either. This might present as low-grade nausea persisting throughout the day, bloating after minimal food, or an unexplained heaviness in the stomach. These are signs of uremia, where toxins that should have been filtered by the kidneys circulate in the bloodstream, disrupting normal gut function and altering how the brain interprets hunger. I've witnessed patients lose 10 or 15 pounds without realizing it, not because they're watching their diets, but because eating simply becomes a burden. They describe peculiar food smells or find that once favorite meals no longer tempt their appetites. This may lead to nutritional deficiencies, and the resultant muscle loss accelerates the body's decline. Appetite loss typically signals a late-stage symptom, meaning your metabolic balance is hugely affected. Uremia's effect on the nerves also deserves attention, not only the cognitive changes, but the physical discomfort it causes. One manifestation is restless leg syndrome, which often appears in chronic kidney disease patients. This is an intense, uncontrollable urge to move, predominantly at night. It's more than bothersome. It disrupts sleep, exacerbates fatigue, and reduces overall quality of life. Some may also experience burning, tingling, or stabbing sensations in their extremities, a form of peripheral neuropathy linked to kidney-related nerve damage. These sensations can become a constant burden, affecting mobility and grip strength. Sleep disturbances frequently accompany kidney dysfunction. You may fall asleep exhausted only to find yourself tossing and turning. Or you might wake up repeatedly, drenched in sweat or darting to the bathroom. These changes in sleep patterns are connected. When kidney function declines, fluids and electrolytes fluctuate at night, prompting more frequent urination and causing blood pressure and heart rate spikes. Hormonal imbalances tied to kidney issues can disrupt melatonin production, affecting your sleep-wake cycle. Over time, poor sleep worsens other symptoms, like blood pressure, mental clarity, and immunity, creating a cascade of deterioration that becomes challenging to halt. Many older patients report an elusive itch that no topical treatment seems to soothe. They describe it as deep, constant, possibly interfering with sleep. Most don't realize this isn't just a skin issue, it's systemic. When phosphorus and urea accumulate because of kidney failure, they provoke a neurological itch response. Additionally, the kidneys regulate calcium and vitamin D, so deficiencies can inflame the skin further. What makes this symptom so cruel is its invisibility to others. This suffering occurs in silence, day in and day out. Changes in skin tone or nail health should never be ignored. Those with advanced kidney disease may notice their skin takes on a gray or sallow hue. This isn't merely dehydration or fatigue. It often stems from waste product accumulation in the blood, combined with anemia from reduced red blood cell production. Together, these factors yield a tired, faded appearance, while nails may turn brittle or develop unusual markings. These shifts can occur gradually, so subtly that you may only recognize them when reflecting on past photos or when drawn to attention by someone else. In medicine, these visual signs are significant, often preceding lab results indicating issues within. Another key indicator is resistance to blood pressure medication. If prescribed medications but blood pressure remains elevated or even rises, your kidneys may be a contributing factor. I've seen patients cycle through multiple medications without stable control, only to discover an underlying kidney issue. This connection is no accident. When kidneys fail to filter effectively, fluid retention and hormone imbalances strain the cardiovascular system, causing high blood pressure to worsen kidney function. High blood pressure and kidney failure often go hand in hand, accelerating each other's damage. You may now be asking, if I experience one or two of these symptoms, does it indicate kidney failure? Not necessarily, but it does warrant prompt action. What truly matters is not the presence of a single symptom, but how they manifest together and how they've shifted over time. Early detection is vital to preventing the progression of kidney failure, urging proactive measures even if symptoms appear mild or unrelated. A simple blood test called serum creatinine and a calculated eGFR, estimated glomerular filtration rate, provide insight into kidney function. Typically, a healthy eGFR is above 90. When it dips below 60, chronic kidney disease is a consideration. Additionally, urine testing for proteins, particularly albumin, reveals potential kidney leaks. These tests are inexpensive, non-invasive, and proficient at catching kidney issues early, often before symptoms escalate. If you've identified several symptoms like fatigue, swelling, changes in urination, unintentional weight loss, brain fog, or persistent itching, or if you have a history of diabetes, high blood pressure, or heart disease, I strongly urge you to consult your healthcare provider. Discuss your concerns openly and request a kidney function assessment. Delaying until signs are indisputable may narrow your treatment options. I share this not to incite alarm, but to empower you. Early detection of kidney issues grants you more control. Effective treatments exist, ranging from medications that reduce protein loss to lifestyle changes that lessen kidney strain, and dietary strategies targeting phosphorus, potassium, and sodium. With proper intervention, it is possible to slow or halt kidney disease progression and maintain a good quality of life for many years. Knowledge is essential. In matters concerning kidney health, tuning into your body's subtle signs can make the difference between managing a chronic condition and facing a medical emergency. Therefore, don't dismiss the fatigue or swelling. Don't excuse away the brain fog. Pay attention to your body, ask questions, and advocate for yourself, because protecting your health is paramount.